Okay, thank you. Okay, opening the Committee on Health, Human Services, and Homelessness for the purpose of having a hearing for Thursday, March 17th, 2022, the 9:30 a.m. agenda. For those here testifying in person and on Zoom, the committee has a 2-minute testifying time frame. Because we are a morning hearing, and actually even today, because we do have a joint that needs to start at 11, we need to get through decision making by noon before session. We are, accepting all written, oral testimony. Please, if you're on Zoom, keep yourself mute and video off while others are testifying. If you use Zoom chat, it goes to our tech staff, not to us. If you get disconnected, please rejoin. If the network fails, then we will try to reschedule if we can make the deadlines. Please avoid using trademark or copyright images, and please refrain from using profanity and uncivilized behavior. Okay. All right. And just want to highlight to everybody, we do have your testimony and it's shared with all the members. Okay, first measure, SB 2635 ST2, relating to the coverage for mammography. DCCA?
Good morning, Chair Yamane, Colin Hayashida, Insurance Commissioner for the Department of Commerce and Consumer Affairs. The department stands on its written testimony in support of this bill. Thank you, Chair, and we appreciate the opportunity to testify.
Thank you, Commissioner. Okay, we have testimony provided by Department of Health in comments. The rest are all in support from Rainbow Family 808, Hawaii Medical Association, Ellen Carson, Kimmy Edie Foster, Ashley Galakek, and Anne Freed. Anybody wishing to testify on this matter? Okay, seeing none, members, any questions for the Commissioner? Okay, seeing none, moving on to SB 2397 ST2, relating to child custody. Okay, we have no one that signed up for Zoom testifying. We have comments provided by the judiciary, the Democratic Party in support, Domestic Violence Action Center in support, Early Childhood Action Strategy in support, Hawaii State Coalition Against Domestic Violence in support, and individuals, Marilyn Yamamoto, Amy Chung, and Anne Freed, all in support. Anybody here wishing to testify? Okay, seeing none, members, any questions? Okay, seeing none, moving on to SB 1294 ST2, relating to Medicaid benefit. I have here Department of Human Services.
Good morning, Chair, members of the committee. I'm Judy Moore Peterson, MedQuest Administrator. And on behalf of the Department of Human Services, we stand on our written testimony in support of, in strong support for the restoration of adult dental benefits. We respectfully request that this get funded through the form of the executive budget as opposed to a bill, as that will provide long-term funding and sustainability for this, for these benefits. Thank you so much for the opportunity to testify. I'm available for any questions.
Okay, thank you, Judy. Okay, we have HMSA. Okay. Morning.
Good morning, Chair. Good morning, Vice Chair, members of the committee. HMSA has submitted comments in support of this bill and just respectfully ask that you consider funding this out of the executive budget. Thank you, and we're available for questions.
Okay, thank you. Okay, we have the State Council on Developmental Disabilities.
Hello, Chair. My name is Jay Silver, and I'm here for my boss. Thank you for our told for the State Council on Developmental Disabilities. We stand in our written testimony in support.
Okay, thank you. Okay, Aloha Care. Okay, In support, Hawaii Dental Association.
Aloha Chair Yamani and members of the committee. I'm Melissa Pavlicek. I'm here on behalf of the Hawaii Dental Association, and we strongly support funding adult dental Medicaid. Thank you very much.
Okay, thank you. Don San.
Aloha Chair, and I'm able to take this off. Aloha Chair and Vice Chair and distinguished members of this committee, House of Representatives. My name is Dr. Don Sand. I practice cosmetic dentistry in California. My family's from Hawaii. My father left Hawaii when I was little. I thought I was going to come back to Hawaii to surf, vacation, and work part-time, but I found out the huge disparity that Hawaii adults have. So for 7 years with some of my colleagues, we've been trying to aspire to be champions for this population that the bill is about. My great uncle was Joe Itagaki. I was born Don B. Sand Itagaki. My grandfather was put in internment camp at Sand Island. My dad changed his name to Sand. So that's why I'm Dr. Sand. We support the bill, but we're here to testify on the amount. It's a big problem to try to fix all the teeth of your kupuna and adults who are worthy because of the 12 years of deferred maintenance. So to throw a small amount of money to a huge problem would be a mistake. I'm here to testify that if we get closer to option 2, we will make a huge difference and we'll build. So right now I'm the ambassador for the Hawaii ambassador to NOAA and OHA, the National Network of Oral Health Care Access. They're not as big as the ADA, but they are just targeting this underserved population. I would love to bring all the resources from NOAA to help make this bill, monitor it and build it and create a better program. Thank you so much for giving us this 2.5 minutes. Sorry about the extra 30 seconds. Aloha, and thank you for being a champion for your kupuna and adults.
Thank you. Okay, Hawaii Oral Health Coalition.
Aloha, good morning, Chair Yamane, Vice Chair Tam, and members of the committee. I'm Patrick Donnelly. I'm the statewide Oral Health Coalition Manager for the Hawaii Public Health Institute. Really just want to thank you guys for taking time to hear this important issue today. We submitted our written testimony to support, but I just wanted to add a couple of comments. Given that adults on Medicaid have gone so long without the core preventive and restorative coverage, we believe that funding for a basic level of coverage won't be sufficient enough to address the high needs of this population. We believe that funding that's more in line with the amount that's reflected by DHS for an option 2 will be much more likely to provide adequate level of care. And additionally, in an effort to avoid returning to the ledge every year, we believe that funding for this coverage through the executive budget would encourage a more sustainable continuity of services moving forward. So we appreciate all the work and consideration that's gone on to this issue. Just respectfully urging careful consideration for what vehicle and what services will provide the greatest level of care to the greatest number of Hawaii residents. Thank you so much.
Okay, thank you. Okay, let's see. So we have that signed up. Okay, Department of Budget and Finance provided comments, and I'm gonna go through. The rest is all in support from Department of Health, State Council of Developmental Disabilities, Hawaii Disability Rights Center, AARP, Oral Health Progress Equity Network, Hawaii Committee of the Democratic Party, Hawaii Appleseed Center, Hawaii Children's Action Network, Ho'ola Lahui, Hawaii Primary Care, United Healthcare, Hawaii Association of Health Plans, ACOG, Americans for Democratic Action, Kaiser Permanente, Hawaii Dental Service, Hawaii Dental Hygienists Association, Waianae Coast Comprehensive, Catholic Charities, Papa'olo Kahi, Ohana Health, Waimanala Health Center, University of Hawaii, Queens Health Systems, Parent and Children Together, DDS, Hawaii Medical Association, Oral Health Progress and Equity Network, and a whole list of individuals, all in support. Anybody here wishing to testify? Okay, seeing none, members, any questions? Okay, seeing none, moving on to SB 2017 SD1, relating to emergency medical services. Okay, let's see, Hawaii Medical Board.
Good morning, Chair Yamane and members of the committee. My name is Alani Kyoki and I'm the Executive Officer of the Hawaii Medical Board. The board will stand on its written testimony in support of this measure. Thank you.
Okay, thank you. Okay, DLIR.
Good morning, Chair Yamane, Vice Chair Tam, members of the committee. Gary Lum, representing the State Bar Council, which is administratively attached to DLIR. I'm standing on a written testimony in support of this bill and available for questions. Thank you.
Okay, thank you. We have testimony from Maui Fire Department, Roberta Hunter, Honolulu Fire Department, all in support. Anybody here wishing to testify? Okay, seeing none, members, any questions? Okay, seeing none, moving on to SB 1134 SD2 relating to adult protective services. Okay, I have here the Department of Human Services.
Good morning, Chair Yamane, Vice Chair Tam, and members of the committee. Lisa Amador from Adult Protective and Community Services Administrator. DHS rests on our written testimony and support, and I'm available to answer any questions you might have. Thank you.
Thank you. Let's see. I also have DHS, APCS, Adult Protective. Or are you speaking on both?
Apologize. Yes. Thank you.
Okay, good. Okay, then we have testimony from Gerald Silva in opposition, comments by Marilyn Yamamoto, and support from Lynn Akasuka. Anybody here wishing to testify in this matter? Okay, seeing none, members, moving on to SB.
Chair,
Oh,
I have a question.
Report.
To the testifier, what's the experience
Which
rating?
testifier? Or DHS?
There's only one, right?
Yeah. Okay.
The
Yeah, there's only
experience
one.
rating or the number of instances that this bill would prevent from abuse? In other words, without a warrant, how many times have you needed this bill?
Thank you for the question. It's quite rare. In the last calendar year, I know of one incident. There may be a couple more. I could get you the exact numbers, but it doesn't happen very often. The concern that we have is not so much the frequency, but when there are cases in particular of caregiver neglect and self-neglect, those can be even more dangerous, more fatal than physical abuse cases. So although it doesn't happen very frequently, when it does, it's imperative that we're able to get in a timely manner.
Okay, maybe I wasn't clear. How many times have there been abuse, like you say is happening, where you had to do a warrant in order to intervene?
We have not had to
You've not had
get
to get a
warrants.
warrant?
No.
Because this one says you don't have to have a warrant. So if you don't need a warrant to get a warrant.
I apologize. We haven't had to use the warrant route. We have been able to get in to the homes for physical abuse cases.
Without this bill, correct?
Yes.
Been able to get into them. Okay, that's all I needed to know. Sorry. Thank you, Chair.
Okay, thank you. Any others? Okay, moving on to SB 2137 SD2 relating to transitional housing. I have Department of Health.
Aloha, Chair Yamane, Vice Chair Tam, and committee members. John Valera, Acting Administrator for the Alcohol and Drug Abuse Division, testifying on behalf of the Department of Health. We're standing on our written comments in support of this measure and are ready for any questions. Thank you very much.
Okay, thank you. We have comments provided by the Department of Public Safety, support from Hawaii Substance Abuse Coalition, and opposition from Gerard Silva. Anybody wishing to testify in this matter? Okay, seeing none, members, any questions? Okay, seeing none, moving on to SB 2459 SD1 relating to language access. I have here DLIR.
Hello, Chair Yamane, Vice Chair Tam, and members of the committee. My name is Kristen Lee, and I'm testifying on behalf of the department for Director Pereira Eustaquio. The department stands in support of the measure, specifically Section 2. Thank you.
Okay, thank you. I have DCCA.
Good morning, Chair, Vice Chair, members of the committee. Kat Awakuni-Kalona on behalf of DCCA. DCCA stands on our written comments, appreciating the intent and noting our great appreciation for this committee's version of HB 1762 HD1. We really did appreciate that approach. Thank you.
Okay, thank you. Department of Human Services.
Good morning, Chair and members of the committee. This is Carrie Uesugi with the Department of Human Services. Thank you for the opportunity to testify on this bill. The Department of Human Services stands on our written testimony and support the intent of this measure. Thank you.
Okay, thank you. Hi, Emma.
Good morning, Chair, Vice Chair. My name is Luke Myers, the Administrator of the Hawaii Emergency Management Agency. We stand on our written testimony offering comments on Senate Bill 2459 and are available for discussion if necessary. Thank you so much.
Thank you, sir. Okay, Office of Language Access.
Good morning, Chair. Good morning, Chair Yamane, Vice Chair Tam, and the member of committee. Afirat Mamnuran from the Office of Language Access. We stand on our written testimony offering comment on this measure and available for any question the committee may have. Thank you, Chair.
Okay, thank you, AP. Okay, Hawaii Friends for Civil Rights. Okay, in support. Hawaii Coalition for Immigrant Rights.
Chair Yamane and Vice Chair Tam, members of the committee. My name is Liza Ryan Gill. I'm the co-chair of the Hawaii Coalition for Immigrant Rights, representing more than 25 organizations and over 100 individuals foreign born. We are in strong support of SB 2459 SD1. This is actually our primary bill and campaign as an entire coalition. We want to thank first the House for saving the Office of Language Access last session when it was had the potential of being lost in that budget. And just as a reminder, 40% of our agricultural workers are foreign born. It is important for folks in combating labor trafficking and human rights abuse, wage theft, for folks to have information in their own language. And so we're really interested, first and foremost, in strengthening the office and also making sure that we have a proper survey and working with the departments to see how we can connect them better to our multitude of foreign born and limited English proficient communities. If you have any questions, we'll be here. Thank you.
Thank you. Okay, we have a whole slew of testimony, all in support from Hawaii Office of Community Services, Common Cause Hawaii Catholic Charities, Legal Clinic, Hawaii Children's Action Network Speaks, Hawaii Coalition for Immigrant Rights, Refuge Advocacy Lab, and a whole list of individuals, all in support. Members, any questions? Okay, Chair quickly has a question for DCCA Director.
I'm here, Chair.
Hey, when we heard the House bill, we looked at just providing the resources to Office of Language Access and then having them be able to work with all the departments. If we continue that same position, would then departments like DCCA then be able to support and coordinate with Office of Language Access?
Yes, we think that that's a more efficient use of the resources. And we think it has a more sustainable approach.
For long term?
Yes.
Okay. All right. Then that would then potentially change your position from comments to support?
Correct.
Okay. All right. Thank you. Okay. Thank you. Members, any additional questions? You have a question? Okay. Seeing none. Thank you. Okay. Moving on to SB 2700 SD2 relating to early childhood registry. We have Department of Human Services.
Good afternoon, Chair, Vice Chair, and committee members. Joseph Campos on behalf of Director Betts. I'm here to testify and thank you for the opportunity. The department stands on its written testimony, appreciating the intent of the bill, providing comments and requesting amendments. Thank you.
Okay, thank you, Deputy. Early childhood action strategy.
Good morning, Chair, Vice Chair, and other committee members. My name is Vivian Eto, and I'm here on behalf of Early Childhood Action Strategy, speaking in support of SB 2700 and on behalf of the improvements to the Early Childhood Workforce Registry. You have ECAS's written testimony. I just wanted to take this quick opportunity to stress for you all the pressing need we have for good quality data about our child care workers. The childcare workforce has always suffered from chronic recruitment, retention, and turnover issues, and these issues have just gotten dramatically worse with the pandemic. Childcare programs are facing one of the most dire of hiring situations across all employment sectors, and as a result, we've lost desperately needed capacity in our childcare programs. We can't begin to rebuild and strengthen our childcare system in our state without addressing workforce issues, but we need good local comprehensive data to do that. The bill before you is critical to improving the collection and quality of key childcare workforce information, and we ask for your support in passing this measure. Thank you for the opportunity to testify, and please know I'm available for any questions.
Okay, thank you. Hawaii Children's Action Network.
Aloha, Chair and Vice Chair and committee members. I'm Kathleen Algar with Hawaii Children's Action Network Speaks. We are testifying in strong support of this measure today. I appreciate the comments made before about understanding the ongoing challenges with childcare and our early care and learning workforce. And I want to touch a little bit on what the state needs, how the state needs to pivot in order to plan for the future. In the last 2 years, I think almost exactly 2 years to the day, we started to see a closure of schools, of our childcare, of our child caring programs, among other businesses across the state. While we have seen an uptick in return in some of our other businesses, childcare is one where we are actually continuing to see closures. We're losing a workforce, but we don't actually know how many. If we want to be able to build the childcare system and early care and learning programs that our state does desperately want and need, we're going to need to know this information about how many folks we have working in childcare, how long folks have been in it, and the number that we need to grow into. So we're asking for your support. We hope that you see the level of importance that this issue is. I'm available for any questions. Thank you so much.
Okay, thank you. Okay, Hawaii State Commission on the Status of Women. Okay, in support, we have testimonies. The Budget and Finance providing comments. We have the support from Executive Office of Early Learning, AAUW of Hawaii, a whole list of individuals, A-Firm, Hawaii in support. We have one opposition from Gerard Silva. Anybody here wishing to testify? Okay, seeing none, members, any questions? Okay, the chair has questions for Department of Human Services, Deputy.
Yes, Chair.
You guys offered amendments, right, to as suggested for the registry for, I guess, the information protection. If that is included into the House version of the measure, would you guys go from comments to support?
I believe we would, Chair, but I would like to refer to Dana Luca, who is on this call as well.
Okay, please.
Dana.
Hi, Chair Yamane. Thank you for the question. Yes, we would go for, if we changed, if we did that amendment, we would go for support of the bill.
Yeah, we would use, okay, so if we did the House version, right, but we would put in those, your requested amendments on page 3, as well as inserting for that Part D, then I think it would address the concerns from the department.
Yes.
Okay, thank you.
Thank you.
Okay, moving on. All right, we're going to move on to SB 2857 SD2 relating to child wellness. Or, yeah, 2857, right? Sorry, SD2. Department of Human Services.
Good morning, Chair, members of the the committee. I'm Judy Moore Peterson, MedQuest Administrator. On behalf of the Department of Human Services, we appreciate the intent of this measure as long as it does not displace or reduce funding for our priorities identified in the executive budget. Thank you so much.
Okay, thank you. Okay, we have comments provided by Budget and Finance, testimony from HMSA.
Good morning, Chair, Vice Chair, members of the committee. HMSA has submitted testimony in support of this bill and would just like to note the importance of a well child visit in order to provide preventative services for Hawaii's keiki. Thank you, and I'm available for questions.
Okay, thank you. Okay, we have testimony opposition from Hawaii Family Advocate Team. We have in support from Hawaii Association of Health Plans, support from American Academy of Pediatrics, and from Robert Douglas, and opposition from Gerard Silva. Anybody here wishing to testify? Okay, members, any questions?
Chair, I have a question.
Okay, report.
HMSA, please. First, thank you for being here in person. Appreciate that. Did you find parking?
I was able to find parking. Thank you for asking.
It says no parking for the public, so there's a lot of spaces. How many, I'm looking first at the universe of Medicaid eligible families for this. Do you have any number? Mothers with kids who are on Medicaid. What's the universe?
Thank you for the question. Right now, I apologize. I do not have that specific number. I will note that we do have a significant amount of our population in Hawaii, especially after the pandemic, that have been affected and are now on Medicaid.
Well, the bill implies there's a lot of mothers who are not getting their kids checked up. I'm trying to get a metric on the intensity of the bill.
Thank you for asking that question. I can only speak to our population, but in general, from our perspective, the challenge in getting a child a well child visit, as you're asking, is a multitude of challenges. We look at the social economic factors, the difficulty in sometimes a parent taking a child to the physician's office, and there's a multitude of other things. I apologize, I'm not necessarily an expert on the clinical delivery for this population,
but it's to incentivize the mother to come for the kids. So how many wellness examinations does HMSA do?
I apologize, Chair. I don't have that.
You don't have
answer
that
right
one
now.
either.
No, I'm sorry.
Is there anything in the bill that says you will spend this for Uber or other purposes to get to the wellness thing, or you've got to get the wellness and then you get the money, you spend it whatever you want?
My understanding is that the incentives is provided to the family, and some of the stipulations are not as specific as to whether it's allowed for an Uber driver.
Do you have any experience in Blue Cross and your brothers and sisters on the mainland who have got similar programs and they actually worked?
There are a variety of programs that provide incentives, whether fiscal or non-fiscal, that have shown to be of value. But I do want to make sure that I note the comments from MedQuest that I do not want my comments to be misinterpreted as saying that we should divert any funds from their existing budget to this program.
Because we don't have any budget estimates, do we?
Well, I just want to say that I can't speak on their behalf, and I don't want to insinuate any of their financials.
Chair, are they here? We could ask for a budget estimate.
Judy's on the line.
She's on the line. One last question, HMSA. In other programs on the mainland, how long do they take to go into effect? This is a 5-year program. Do you think people are not going to know in 2 or 3 years? 5 years seems like a long pilot, is my point. When HMSA changes one of its policies, how long does it take really for the membership to wake up and understand that, hey, there's a difference going on here?
Thank you for the question, Rep. That's a very tough question to answer. For a program like this, I think there would be the ability for it to get up to speed, hopefully in a fair and adequate amount of time.
Okay. Again, thank you for your question.
No, thank you.
Judy, MedQuest administrator is on the line, so
Chair,
you
I
can ask
proceed
her
with-
the question.
Yes.
But I think she'll appreciate Matt's response of not speaking for them. Thank you, HMSA. Okay,
Thank you.
Should I ask her to counter what he just said?
DHS, did you want to comment to the representative's question?
Aloha, aloha, Representative. Thank you for those questions to Matt and to HMSA. I appreciate his responses. I will note that we estimated in our testimony, we included the fact that we cover approximately 51,000 Quest parents, and then those parents have about 90,000 children on our program.
Could you
Currently,
repeat that number again? Did you say 50,000? Have
There's
90,000 children?
that is correct. There are about 50,000 parents currently on MedQuest, and they have approximately 90,000 children. We cover a lot more children, but the bill itself references paying, the benefit goes to, it doesn't follow the child, it actually is paid to the parent. So that's the count are the parents. And then, so go ahead.
How many mothers are skipping their kids' examinations is the question.
Well, one, this is not specific to mothers. This is actually specific to parents. So we know that both the mothers and their dads take their kids in for their care, and primarily there's actually a quite good take up in. We have the majority, about 80% of the parents and children get their well child visits. So we know that that parents are bringing their children in. I think this bill, in speaking with the proponent, Senator Joyce and Buenaventura, her desire is to provide some additional financial incentives to help cover costs and to help ease to help provide help to these families to bring their children in.
And so the goal would be 100% examine. Well,
Goal would be to have
Well,
the parents, 100% of the parents be able to bring their kids in. Mhm.
And as I asked earlier to HMSA, do you know of other programs that have worked well as an incentive and they did get up to 100%?
I don't know of any program that's been able to get up to 100%.
Or
Usually,
the vast majority.
yeah, the vast majority. The two things that I would note here is that most of the health plans that we contract with provide non-financial incentives to help encourage parents to bring their kids in, and those are in place. And we do have mechanisms to actually use some federal matching funds to help promote these kind of incentive programs. When it comes to financial incentives, we are not able to use any federal matching funds. And so, and our estimate is if 100% of the parents did take advantage of this, it would be about $4.5 million estimated cost. We did include that in our testimony. So when you have the opportunity to take a look at it, you can.
1.5 million. Okay, last question.
Mhm.
How long does it take for word to get on the street? Hey, you bring in your kid, you get an examination, you get $50. How long does it take? My question is, do we need a 5-year program or is 2 to 3 years enough? In your experience with this kind of a incentive program or with other things that, when we increase the registration on our cars, people took 2 years for them to realize that, hey, it's costing an arm and a leg to register your car nowadays. What's your experience?
Yeah, no, thank you for that question. I think that the word would get out relatively quickly, and people would take advantage of it relatively quickly. So I don't necessarily think that's where it's not the finding out about it, but it's a matter of understanding the long-term impact and if how much of an increase there was, et cetera. Sometimes you need more than 1 or 2 years, but I think 2 to 3 years, it's possible that we'd be able to do an evaluation and figure out the impact.
But 4.5 billion per year, as you said, right?
That's an estimate of if every parent took advantage of it for all of the kids that we are currently covering.
Thank you for those numbers. Appreciate it. Thank you, Chair.
Okay, thank you. It's glad to see Quest and HMSA working together. All right, no further questions. Moving on to SB 3106 SD2 relating to exemptions from civil service for positions in the Department of Human Services. Department of Human Services.
Good morning, Chair, Vice Chair, committee members. Joseph Campos, Deputy Director, Department of Human Services, here on behalf of Director Betts. The department stands on its written testimony in support of this measure and also requesting that the effective date be moved to no later than June 29th, 2022. Thank you for the opportunity to testify, and I'm here for questions should you need any.
Okay, thank you. We have testimony and support from Early Childhood Action Strategy and Parents and Children Together. Anybody else here wishing to testify? Okay, seeing none. Okay, we will, members and audience, we have a joint at 11 with EEP, and we will be recessing this agenda for decision-making following that joint session. Okay, we are on recess. Opening the joint committee hearing with the Committee on Health, Human Services and Homelessness and the Committee of Energy and Environmental Protection for Thursday, March 17th, 2022, 11 a.m. agenda. I just wanted to highlight to those that planning to testify that we have a 2-minute time frame for these measures with HH. We want to remind people that we need to get through these NDM before 11:30 or 12 to get to session. If you're not testifying, please mute yourself and turn your video off until you are called upon. If you chat, you're not going to get us, you're going to get our text. If something goes wrong, please try again. If not, oh well, no, I mean, we'll try to set back up. Please avoid using trademarks and copyright images, and please refrain from any any profanity and uncivilized behaviors. Okay? Thank you. Moving to first measure, SB 2600 SD2 relating to underground storage tanks. I have here DLNR, Seaworm.
Hello, chairs and vice chairs and committee members. We stand on a written testimony offering comments in support and offering comments. Here to answer any questions with Ryan Imata from my staff. Mahalo.
Okay, thank you, Claire. Okay, Department of Health.
Aloha, Chair Yamane, Chair Lowen, Vice Chairs, members of the committees. My name is Noah Klein. I'm with the Department of Health Solid and Hazardous Waste Branch. The department supports this measure. It's our preferred vehicle for now. And so we're offering a couple of minor clarifying amendments, and I'm here to answer any questions that you may have. Thank you.
Thank you. Board of Water Supply. Okay, they testified in support. Our Revolution Hawaii. Okay, all right, they testified in support. Okay, we have HSTA. Oh wait, sorry, too far. Wait, hold on. Okay, everybody testified in support. I'll read off the groups. Sierra Club, Hulu Mamo Hawaii Civic Group, Surfrider Foundation, Hawaii Public Health Institute, the Democratic Party, 350 Hawaii, Livable Hawaii Kaihui, League of Women Voters, HACBED, Hawaii Alliance for Progressive Action, Aloha Aina legal groups, and a whole host of individuals, all providing testimony in support. Anybody wishing to testify? Okay, seeing none. Members, any questions? Ward.
Chair, was it Dylan? Who was the first testifier?
Dylan R. Seaworm.
Yes. Lee, is the gentleman still there?
Should be.
Aloha.
Thank you for being present at this very, very important hearing in this bill. The bill says where you can't put the tank, but I was wondering, are we going to incentivize them to bring the tanks on top of the ground? Because everything here refers to underground. And if it's on top of the ground in Pearl Harbor somewhere, it should not be over an aquifer if there is one there. So I see how would you say, the sticks, but are there any carrots that we could add to this bill?
Mahalo for the question. Sorry, again, Kaleo Manuel, Deputy with the Water Commission. From our perspective, I think we would defer to Department of Health, who does regulate the underground storage tank program, and where that should be potentially sited, if not underground, on its location. For us at the Water Commission, all of our water resources are important. It's a really difficult dilemma to be in, but managing and looking at a proper location and siting is going to be challenging. From our perspective, we just wanted to highlight in our comment that while the UIC line is important to protect drinking water, even below the UIC line, there are other resources that are just as important from the Water Commission's perspective. So siting is going to be really critical. I don't think that directly answers your question, but I don't have a specific solution to the question you're asking.
Let me rephrase it. Is there an aquifer in and around the vicinity where there is the highest likelihood that they would put the on top of the ground tank?
I don't know. This is all, a lot of it has to do with land ownership, siting and location above ground. And there's other factors to consider in that decision-making. I have not been privy to those conversations or know where or on another adjacent location for the siting of these fuel tanks if they were to move above ground.
Okay, thank you for your presence. Thank you, Chair.
Thank
Okay,
you.
anybody else have any questions? Okay, seeing none, I'll let Board of Water Supply, you have any comments since we had some tech?
Yes, Chair Yamani, Kathy Mitchell for the Board of Water Supply. Manager and Chief Engineer could not be here, but we strongly support this measure.
Okay, thank you. Okay, anybody else have any questions? Okay, seeing none, moving on to SB 2172 ST2 relating to underground fuel storage tanks. Attorney General?
Good morning, Chairs Yamani and Lowen, members of the committee. My name is Wade Hargrove, Deputy Attorney General, here for the Department of the Attorney General. Just wanted to provide context for the written testimony and make myself available for any questions. I think the committee may already be aware of the subject title issue that's been raised in the testimony.
Yes.
Right, thank you. And just wanted to make sure that there was an understanding that there may be a better vehicle, given that 2600 does not have that same problem.
Yes, we're right. Thank you.
Thank you very much.
Okay. Department of Health.
Aloha, Chair Yamane, Chair Lowen, Vice Chairs and members of the committee. The department will stand on its written testimony, and I'm here to answer any questions. Again, Noah Klein from the Solid and Hazardous Waste Branch. Thank you.
Thank you. Seaworm.
Hello again, Vice Chairs, and committee members. We stand on our written testimony in support and offering comments. Mahalo.
Okay, thank you. Our Revolution Hawaii. Okay, in support, HSTA.
Aloha, Laverne Moore, speaking on behalf of Oso Tui Jr., President of the Hawaii State Teachers Association. We strongly support this bill with one statement I want to make. The HSTA believes that every school's drinking water should meet Environmental Protection Agency requirements for clean drinking water. Mahalo for the opportunity to testify.
Thank you, Laverne. Okay, members, we have testimony all in support from a whole list of individuals. Oh wait, sorry, Board of Water? Sorry, before I go to that, Board of Water Supply?
Kathy Mitchell, the Board of Water Supply. BWS stands in strong support of this measure.
Okay, thank you. We have support from the Association of Native Hawaiian Physicians, Hulu Mamo Hawaii Civic Clubs, Hawaii Pacific Health Institute, Surfer Foundation, League of Women Voters, Environmental Caucus of Democratic Party, Papa Olokahi, Livable Hawaii Kai Hui, 350 Hawaii, Sarah Club, Hackbed, Hawaii Alliance for Progressive Action, Hawaii Thousand Friends, Aloha Aina Legal Group, and a whole list of individuals, all in support. Anybody else wishing to testify? Okay, seeing none, members, any questions? Rep Ward?
Board of Water Supply, please. On page 2 of the bill, line 10 says, permits near aquifer prohibited. But then it goes on to say it's only underground tanks that are prohibited on top of an aquifer. Wouldn't it not be more precise to what we're intending to do is to make sure we don't get even a on top of the ground tank over an aquifer? If you look at line 11 and 12, it just says underground tank. It doesn't say above ground or generically tanks. It just says underground tanks, you got to stay away from aquifers. Therefore, it suggests in its absence that you're going to have a tank on top of an aquifer. Not an underground tank, but a tank that's on the surface of the ground. Page 2, with that, is the intent to only make it underground specific from your Board of Water Supply point of view?
Board of Water Supply does not support any underground tank or fuel tank above the aquifer that has a capacity of 100,000 gallons or more.
But this bill only prohibits those which are underground, not above. You just said you want no tanks above an aquifer.
Fuel tanks that have the capacity of 100,000 gallons or more fuel that threaten the aquifer.
Okay, so that's above and below just of that particular size. Okay, thank you.
Okay, thank you. Any additional questions? Okay, one question for the Attorney General, just to clarify. In the testimony regarding the constitutional potential issue with the title, I know you guys offered amendments. However, the question is, even with those amendments, would it be still potentially problematic? Is that a correct statement?
The position of our office is that with the proposed amendments, the bill would not be problematic with respect to that constitutional provision.
However, you guys prefer 2600?
Right. I think that's just echoing the preference of the Department of Health. The substance of the two bills are almost, functionally equivalent is I think the way I would put it. But the advantage of 2600 is that it's written in a way that the terms that are used, underground storage tank, rather than using a term underground fuel storage tank, is more consistent with the chapter as it exists. And this is, of course, 342L. So I think just from a drafting perspective, just the synergy with 342L will happen more organically with the use of 2600 the way it's currently written.
Okay, so that makes it more clear then for you guys, right? Okay, thank you.
Thank you.
We will take a brief recess. Okay, members, reconvening for decision-making purposes for the Committee on Health, Human Services, Homelessness, and the Committee on Energy and Environmental Protection for these measures that were on the hearing notice for Thursday, March 17th, 2022, 11 a.m. agenda. Okay, members, the first measure, SB 2600 ST2, relating to underground storage tanks. Members, the recommendation of the chair after conferring with both chairs is to move this measure forward as an HD1. Members, we're going to be inserting the Department of Health suggested amendments. We need to make technical amendments and use a 7/1/2060 effective date. Members, any discussion?
Sure.
Yes.
If I remember our PACOM briefing, of which I think probably most of us at this table were at, the proposed relocation of the underground tanks was an above ground tank somewhere within the Pearl Harbor nearness to the ships that were docked there, and how then they could feed the fuel to the airport. This bill is like in the other bill, only mentions underground tanks away from aquifers. It's got to be above ground tanks if we really want to cover our aquifer as well, unless there's something missing here. I think it's the tanks near the aquifer, whether they're under the ground and closer to the aquifer or whether they're above the ground. The Board of Water Supply, I think, made it somewhat clear vis-a-vis some of the military briefing that we got that, hey, if we do it, we're not gonna put it near an aquifer. This one kind of has a bit of a blind spot. It doesn't mention that. That's just my comment. Thank you.
Okay, anybody else? Okay, seeing none. Okay, with conference with Chair of EP, Vice Chair, please take the vote.
Voting on Senate Bill 2600 STG, Chair's recommendation is passed with amendments. Chair, Vice Chair votes aye. Rep Gates.
Aye.
Rep Har.
Aye.
Rep Capella.
Aye.
Rep Nishimoto. Rep Ward.
Aye.
Chair recommendation is adopted.
Okay.
Committee on Energy and Environmental Protection, same recommendation.
The chair voting on SB 2600 SD2, chair recommends passing with amendments. Chair, Vice Chair vote aye. Representative Hashem. Representative Matayoshi. Oh, excuse me, excused. Representative Pruso. Representative Todd.
Aye.
Representative Tokioka.
Aye.
Representative Matsumoto. Chair, your recommendation is adopted.
Okay, thank you, everybody. Moving on to SB 2172 SD2 relating to underground fuel storage tanks. In light of the testimony regards to the potential title conflict and what we having a measure moving forward, the chair is going to recommend we defer this measure. Okay, any discussion? Seeing none, we are adjourned. Okay, members, thank you. Reconvening the Committee on Health, Human Services, and Homelessness for the purpose of decision-making for Thursday, March 17, 2022, the 9:30 a.m. agenda. Thank you, members. Okay, first measure, SB 2635 SD2 relating to coverage for mammography. Members, the recommendation of the chair is we're going to use the House language, which was in HB 1774 HD2. We're going to put that, use that language in this bill, changing the language. It's technical amendments we're going to add and use a 7 in the original 1774 HD2 has a 2060 effective date already. Okay. Members, any discussion? Okay, by the way, there is germane because it was the exact same bill. It just we have a little bit of a difference in language interpretation. Okay, members, any discussion? Seeing none, Vice Chair, please take the vote.
Voting on Senate Bill 2635 SD2, Chair's recommendation is to pass with amendments. Chair, Vice Chair votes aye. Rep Gates.
Aye.
Rep Har.
Aye.
Rep Capella.
Aye.
Rep Nishimoto.
Aye.
Rep Ward.
Aye.
Chair recommendation is adopted.
Thank you, members. Moving on to SB 2397 SD2 relating to child custody. Members, recommendation of the chair is to move this measure forward. We did want to highlight that there are some concerns because they have stated in there Hawaii State Coalition Against Domestic Violence, which make it a procurement and contracting issue. So we're going to actually change that. So where it's reflected that it's a nationally accredited Hawaii-based program, we need to make technical amendments and use a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on Senate Bill 2397 SC2, Chair's recommendation is to pass with amendments, noting for the presence of all members. Anyone with reservations? Any noes? Chair recommendation is adopted.
Thank you, members. Moving on to SB 1294 SD2 relating to Medicaid benefits. Members, the recommendation of the chair is to move this measure forward. We're going to change the effective date to 12. How about we just use 7/1/2060? Yeah, we'll just change the effective date. But the chair would like to note that the amount in there is blank currently. Okay, so we're just changing it so that we can bring it to conference. Members, any discussion?
Sure.
Yeah.
Just want to thank you, Chair and Vice Chair, and the committee for moving this measure out. This is very important.
for a lot of people in my community. And this has been a priority for my health center in YNI as well. So thank you for continuing the discussion. Looking forward to getting this passed.
Great. We'll include you in the discussions. Thank you. Vice Chair.
Voting on Senate Bill 1294, Chair's recommendation, SD2 Chair's recommendation is passed with as an HD1, noting the presence of all members. Any reservations? Any noes? Chair recommendation is adopted.
Thank you, members. Moving on to SB 2017 SD1 relating to emergency medical services. Members, the recommendation of the chair is to move this measure forward. We need to make technical amendments and then use a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on SB 2017 SD1, Chair's recommendation is passed with amendments, noting the presence of all members. Any reservations? Any noes? Chair recommendation is adopted.
Okay, thank you. Moving on to SB 1134 SD2 relating to adult protective services. Members, the recommendation of the chair is to move this measure forward as an HD1. We're going to insert the recommended amendments from the Department of Human Services. We're going to need to make technical amendments and use a 7/1/2060 effective date. Members, any discussion?
Chair, question, what were those amendments that the DHS suggested?
Yeah, so they are located in their testimony, but basically it is the amendments as requested is, hold on, let me pull it up. Where is it? Right here. Okay, it's the one that we're adding the terms caregiver neglect, self-neglect, and physical abuse.
But you know, when I asked the testifier what the instances experience rating was, she could only remember one. One out of a population 1.4 million is not very heavy. Basically saying that it wasn't needed. I mean, I like the bill, but if there's not a need for it, why should we pass a bill for the sake of passing a bill?
This administration bill, I think, is trying to prevent that way they don't have one negative incidence. And so if this will add and protect somebody even for one instance.
Well, they said they didn't need it because they actually are intervening based upon whatever powers that they said they had. Anyway, just
Okay.
a comment.
Just so you know, this is their bill. It's an admin bill at their request. Yeah.
Maybe they don't collect the numbers before they do these things.
Okay. All right. Any other further discussion? Seeing none, Vice Chair.
Voting on SB 1134 ST2, Chair's recommendation is passed with amendments, noting all members present. Any reservations? Any noes? Chair recommendation is adopted.
Okay, thank you, members. Moving on to SB 2137 SD2 relating to transitional housing. Members, the recommendation of the chair is to continue this discussion forward. And we're going to just, as an HD1, we're just changing the effective date 7/1/2060 to bring it to conference. Hopefully. Members, any discussion? Seeing none, Vice Chair.
Voting on Senate Bill 2137 SD2, Chair's recommendation is to pass with amendments, noting all members present. Any reservations? Any noes? Chair recommendation is adopted.
Okay, members, moving on to SB 2459 SD1 relating to language access. Members, the recommendation of the chair is to use, I guess, our recommended language which this committee passed in HB 1762 HD1. Members, in that measure, just to recall, is rather than embedding them in the department, that we would give them to the Office of Language Access, which then would work with the other departments. So we have consistency and form on moving on to language access. So members, we are going to insert or replace SB 2459 with HB 1762 HD1. Okay, members, any discussion? Okay, seeing none, Vice Chair.
Voting on Senate Bill 2459 SD1, Chair's recommendation is passed with amendments, noting all members present. Any reservations? Any noes? Chair recommendation is adopted.
Okay, thank you. Moving on to SB 2700 SD2 relating to early childhood registry. Members, the recommendation of the chair is, again, this good committee heard HB 2193 HD1. We're going to put that in, replace it, the language to match the House position, as well as we're going to be inserting DHS recommended amendments. We need to make technical amendments, and we're going to blank out the appropriation. Members, any discussion?
I'm sorry, Chair, what was the House bill number again?
HB 2193 HD1
Got it, thank you,
with the same title.
thank you.
Okay. Any further discussion? Okay, seeing none. Vice Chair?
Voting on Senate Bill 2700 ST2, Chair's recommendation is passed with amendments. Noting all members present, any reservations? Any noes? Chair recommendation is adopted.
Thank you, member. Moving to SB 2857 SD2 relating to child wellness. Members, the recommendation of the chair is we need to make technical amendments and use a 7/1/2060 effectively. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on Senate Bill 2857 ST2, Chair's recommendation is passed with amendments. Noting all members present, any reservations? Any noes? Chair recommendation is adopted.
Okay, members, moving on to SB 3106 SD2 relating to exemptions from civil service for positions in the Department of Human Services. Members, we did hear HB 2138 and we passed it out. On this measure, we're using the same format. However, we're just going to do technical amendments on this measure and use a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on Senate Bill 3106, Chair's recommended, ST2, Chair's recommendation is passed with amendments. Noting all members present, any reservations?
Reservations.
Reservations for Rep. Capella. Anyone else with reservations? Any noes? Chair recommendation.
Okay, thank you, everybody. We're adjourned. Thank you.